Hello again. I've recently received a request to discuss how organ failure will affect some of the common neuromuscular blockers that we use in anesthesia practice. So I am using charts that were taken from the textbook Anesthesiology by Longnecker. So let's look at Pancuronium. Okay? Pancuronium. So, what do we know about Pancuronium? Well, we know that it is a long-acting neuromuscular blocker, and according to Longnecker, has a half-life of roughly 2 hours. Now, in the presence of renal failure, we see that half-life can be extended nearly 2.5 times. Now, with hepatic failure, we can see that half-life extend nearly 3 times. And in cirrhosis, it extends substantially, and with biliary obstruction as well. So Pancuronium is greatly affected by organ dysfunction. So now let's look at Vecuronium. Okay? Vecuronium is an intermediate-acting non-depolarizing neuromuscular blocker that, according to Longnecker, has a half-life of roughly 80 minutes. In the presence of renal failure, in some studies it has increased nearly 20 minutes, and in other studies there's minimal change to a doubling of the elimination half-time. In the presence of hepatic failure, in this study quoted by Longnecker, it may actually decrease. With cirrhosis, there's a minimal change, and biliary obstruction shows a change of nearly 20 minutes in duration that it lengthens. Now let's look at Rocuronium. Rocuronium is a intermediate-acting non-depolarizing neuromuscular blocker with elimination half-time of roughly 70 to 75 minutes according to Longnecker. Now, in the presence of renal failure, it may minimally change, or it may change nearly 30 to 50 minutes in duration. It may lengthen. In the presence of cirrhosis, it could actually decrease or increase substantially by nearly 50 to 60 minutes. But if we look at Vecuronium and Rocuronium, we see that their profiles are very similar in regards to elimination in the presence of renal or hepatic dysfunction. Now let's look at Sisatracurium. Now, Sisatracurium is a non-depolarizing neuromuscular blocker, but its metabolism is organ independent. Okay? It uses something called Hoffman elimination, which is a pH and temperature mechanism to degrade the molecule. It has an elimination half-time of roughly 25 to 30 minutes, and it does not change in the presence of organ dysfunction. I hope this helps.